Are you thinking about doing a residency? Are you a confused PT, a new grad PT, a PT student that wants to get your career off the ground and hit the ground running? Do you think you need to do a residency to do that? I'm going to tell you in less than 6 minutes what you could do instead and get way more bang for your buck. But first, make sure you hit the subscribe button so you get notifications when we drop new information here on this YouTube channel. So let's take a look and break down residencies versus the MemberShift. So if we look at expense, residency, if you're a new grad, you're going to take about a $12,000 to $15,000 pay cut in order to do a residency, because you're going to sacrifice about 15 to 20% of your pay in order to just do this. And that's being lenient. So sacrifice $12,000 to $15,000 of your income. MemberShift is going to cost you an investment of $5,200. Why is this an investment and this is a loss? Because at the end of a residency, you're going to be able to do the same things you could do before the residency, get the same job that you had before the residency. You just decided to give up that much money in order to go through it. So you lose that money. Nobody's going to give you a pay increase after a residency because you're going to just learn more of the same stuff that everybody else already knows. When you do this and you spend $5,200 up front to invest in your future, this is going to come back to you in 5 to maybe 10 months. So most of the professionals that go through the MemberShift get out, they open their own cash pay models faster than they thought they could, and they make up to $14,000 a month within spending this 6 months earlier. So they're getting this money back because they're investing in their future, they're investing in themselves, and that money comes back in increased income that you are going to make on your own. So, as we see, that would be a much better idea. Time, residency, 12 months of your life, gone. MemberShift, in less than 5 months, we're going to teach you how to recreate your skill set, your future, your career, your thought process, your results. In less than 5 months, we're going to change everything. Over the span of 12 months, not only going to lose that much money, but you're going to get out and do relatively the same things that you did and have the same jobs that you had before. So once again, win goes here. How about extra time invested on a weekly basis? So during a residency, you're going to be looking at evidence-based practice, going through research, writing papers, giving presentations. Sounds a lot like PT school. So you're going to have another 12 months of PT school and another 4 to 8 hours to add on top of your 40-hour work week while you're working for these guys for a pay cut. With the MemberShift, it's going to take you an hour, maybe 2 hours a week to go through your video module drip, which are going to be sent to your email, which you can go at whatever pace you want to go at. If you've got something come up and you're going to be on vacation for 2 weeks and you can't open it, not a problem. Come back later, get caught up. This is self-paced modules that get sent to your email, and if you go at the pace of the drip, it's going to be a 1 to 2 hour a week investment of your time to stay up with this. So I think you would agree, you would rather spend 1 to 2 hours a week versus 4 to 8 hours a week doing projects and side work for somebody else. All right, so help. Who's going to help you get through your residency? You might be passing by some other professionals in the clinic, toss some ideas at them, get some answers, or maybe you'll ask them a question and they'll just give you more work and say, hey, put that in your presentation. With the MemberShift, you're going to have a community of professionals that are moving through the MemberShift with you. You're going to have access to them 24 hours a week, or 24 hours a week, 7 days a week in our Slack room, where you can post questions, you can post case studies, and everybody will jump in there and help you work through that. You're also going to have 2 Zoom calls a month. So 2 hours a month, you're going to be interacting with your community and myself on Zoom, walking you through any questions that come up during this 5-month process. So once again, MemberShift wins. Mentor, who's going to be your mentor in the residency? Somebody who's in the conventional model, supports the conventional model, makes people go through the conventional medical model, and that's why you're stuck in the conventional medical model. When you come out of the residency, same place you were before the residency. In the MemberShift, your mentor is going to be me. You have access to me, who has been in the conventional medical model, figured out how to reinvent my career, reinvent myself, reinvent my skill set and my thought process to get out of this mess. You will only go as far as you're going to be led. They're going to lead you down the road that you're already going on. I will teach you how to get out of that mess. If you want to open up your own cash pay clinic, I will teach you how to do that. I will teach you everything that you need to know to avoid this, because that's what I did myself. So once again, MemberShift wins. How about thinking? What are you going to learn? Is this a new thought process, or is this just rehash of evidence-based practice, research, 1980s PT, because that's what PTs are expected to do and supposed to do? That's what that is. Same broken thinking, same broken results. Here, we're going to take apart all of your thinking, teach you how to use critical thinking to your advantage, which will be completely new. And then we're going to put everything back together so you know how to get to the root cause of your patient's symptoms rather than chasing symptoms. So you're going to learn critical thinking skills within the first 2 modules of the MemberShift, which will get your wheels turning and show you right away this would have been a really bad idea. All right, how about hands-on learning? Once again, kind of like your mentor and kind of like getting help, you're passing through. You might learn some hands-on things at lunch, you might do some hands-on things afterwards, but you're really just doing regular work and they're doing their regular work, and then you might pass and do some stuff and they might show you some hands-on stuff like Maitland or Mulligan or some other 1980s crap that doesn't work. Here, you're going to have 2.5 days. 2.5 days with your community and myself in the lab, learning things like putting together your thought process, going from eval to treatment to patient education to exercise, learning how to prescribe the correct exercise, and then once you have that down, how do you progress that exercise? Learning how you assess neuromuscular function of every muscle in the body, a test for every muscle, a treatment for every muscle, so that when you get to the root cause of your patient's problem, which is always neuromuscular inhibition, you know how to reverse it so that when you get to exercise progression, it makes sense. You're learning a streamlined thought process that takes you from subjective all the way through exercise progression in one thought process. You're not changing gears and trying to do multiple different things over here. You're going to learn how one thought process treats every patient that walks into your clinic, no matter whether they're a professional athlete or a Medicare patient, they're young, they're old, they're active, they're sedentary. It doesn't matter, because you're going to learn how to break it all down to the root cause, and you'll figure out that as long as you know how to apply neuromuscular physiology, biomechanics, and anatomy, you can become an expert, and physical therapy isn't that hard to figure out. So you're going to get that here. Once again, win. Now, at the very end, if you are somebody that wants to go into business for yourself, you want to do a cash pay clinic, you're tired of working for somebody else, you're tired of the mill, you're tired of depending on physicians who don't know what they're doing, I'm going to teach you how to do that. So the only thing that you don't get for all of that, so your $5,200 investment gets you 5 months of the drip. It gets you Zoom calls twice a month. It gets you Slack room 24/7. It gets you 2.5 days with me in the lab. It gets you everything you need, your manual, your sources cited, showing you how we developed the 180 system and how it's based on science. The only thing you're not going to get is our business coaching program. Once you get through this, if you want to go off on your own, I will teach you the one thing that no other PT business coach is going to teach you, and that's the one thing that you didn't learn in PT school, which you're going to learn here, and how once you apply that to your business, you immediately have people waiting on your doorstep. You don't have to worry about marketing. You don't have to chase people. You don't have to hire multiple coaches. All you need to do is learn this and then take that, and you will be set. So as you can see, residency, even by itself, not a good idea. Residency stacked up against the MemberShift, not even close. When you're ready to reinvent your career in 5 months for a $5,000 investment, get to my DM me, let me know, reach out, and I will get you set on the MemberShift and change your career.